So this is part 2, current initiatives to nudge healthier purchases. And this is efforts focused on improving access to healthy food retailers. So it's nice to have a break between the two sessions so you can kind of absorb what you learned in the first one. And now we have Allison Carpin from actually the University of Delaware now, recently with the Food Trust, 6 days ago, right? We have Melissa Laska from the University of Minnesota, Barbara McNally from the Public Health Institute in California, and I thought I just saw Andrew. There's Andrew Hanks from Cornell University. So take it away. Allison. Do you want me to move you over here? It's this button. I got it. The title of my presentation is Pilot High and Watch It Fly, and I feel like the longer I work with retailers, the more cool terms that rhyme I get to know. That's one of the first terms I heard that I thought was really funny, and you can imagine this refers to, stacking an end cap or something really high. And I think it actually speaks a little bit more to a deeper conversation. Where that conversation ends, I think we still haven't determined, but the question about, are we selling things that we want to sell, or are we selling things that consumers want to buy, and sort of how do we find the common ground in the mix there, not just pushing, high stacks of cheap products, but also helping consumers make their own independent decisions. Another cute example of choice architecture at work with The Simpsons. So what I wanted to do was review some recent research findings. It was interesting. We had an introduction to randomized controlled trials. The RCT that I completed with Karen Glanz and Gary Foster recently on in-store marketing strategies in the Philadelphia area. I figured I'd give you the kind of quick and dirty on the findings there, and then also discuss a few other projects that we have in the works as current efforts. As someone mentioned earlier, I have been at the Food Trust for a long, long time, and I'm just now migrated over to the University of Delaware. We'll continue to do this kind of work, but I owe a lot to the Food Trust, and all of this work was done while I was there. As an agency that is really committed to providing improved access to affordable, nutritious food, the Food Trust spent a long time building programs and policies and practices that help support the infrastructure development of supermarkets and healthier corner stores in low-income neighborhoods, and that work obviously continues. One of the questions that was raised as part of that work is a store enough, and what can we do once we've made this resource available to communities who didn't have it before so that they're shopping more healthfully? So that was really the start of our work in this field a long, long time ago. Again, back to the beginning, we worked with Robert Wood Johnson Foundation and others, also the University of Pennsylvania was involved with this project, to kind of convene and start the conversation with what would the best practices be. And I think it's interesting now coming back to this conversation 5 or 6 years ago just to see how far we've come. USD and others have supported a lot of that work. So what kind of research efforts are ongoing sort of in my portfolio? The Philadelphia in-store study we completed in the spring, and the publication was just released in April of 2014 in the American Journal of Clinical Nutrition, and this was a randomized study, which I'll talk about in a minute. I've also worked a little bit on a milk couponing project in Arizona with the store Food City, Basha's chain, American Heart Association, Donna Levine and Associates, and Catalina, to look at the impact of couponing of milk on purchases among prior full-fat milk buyers, people who exclusively bought full-fat milk, couponing them for low-fat milk, looking at the change in sales for that low-fat milk. We also have an exciting development on corner stores where we actually have now the infrastructure to track corner store purchases in 6 corner stores in Philadelphia. And so we're beginning to analyze that data, looking at what kinds of shifts in purchasing are happening according to different kinds of marketing strategies. We've seen a lot of increase in fruit and vegetable sales from a kiosk in the control versus the intervention community, and there's a lot more potential there for, I think, studying how these, product placement, the Ps, can be implemented in a smaller store environment. I know a lot of us are probably also interested in the dollar store environment, which we are, but the corner store environment is definitely a different one. And then I will talk about the in-store study, but we also submitted and recently received a good score on an NIH proposal to scale up the Philadelphia study. So hopefully in the fall we'll be looking to roll out a much larger study that will replicate some of the findings that I'm going to share with you today. Last is the web portal page, healthyfoodaccess.org, where a lot of the results of these studies, there's a new in-store marketing page on there, have been reported. Well, that didn't translate very well. So this is the study that I'm referring to. It's called Placement and Promotion Strategies to Increase Sales of Healthier Products in Supermarkets in Low-Income, Ethnically Diverse Neighborhoods. You can tell we don't have Brian or David on our team because it would have a much more succinct, pithy title if we did. So a couple of things that have already been discussed today that I think are relevant to this conversation. When we first went into this, we realized that we were getting ourselves in over our head. And I can tell you that there were times when Gary Foster and Karen Glantz and I would be sitting at a table almost in hysterics at how much thought we were giving to such simple tasks and how much brain power we had around the table, and yet the answer was not obvious. So thinking about how to develop a study and in partnership with the retailer was really our goal. And we came up in early conversations with a few guidelines. When we picked our products, and this is all outlined in the paper, but when we picked our products, we really wanted not to pick some obscure product that we were going to promote. We wanted to stick with the mainstream. We wanted products that people were likely already buying, would conceive of as a reasonable alternative to an existing product. And so we went for an initial look at a number of different categories, and then within those categories at specific products. So we were looking at top-selling products. This isn't on the slide, by the way. Things that were equivalent in price or revenue neutral for the retailer. So we did have those conversations with the retailer. We were going to look to promote products that were a reduction in calories that was sizable enough, which I can tell you in the cereal aisle is really hard to find. There's not that much variation in calories. Obviously, if you're looking at sugar and other things, it's a little harder. When we get to the slide with honeycomb on it and you wonder where honeycomb came from, that's where it came from. And that we're family friendly. So we were interested in things that would potentially impact children and families. We looked, as I said, at a number of different categories. We started off with 11 different categories, and we ended up whittling it down to about 5 that met those criteria, because we were doing this dance between the right kinds of products that would seem to have a potential meaningful effect and that the retailers felt were reasonable products to promote. And it's good to hear from Barry and others that the generics are moving up the scale, because that will help get more in the hopper, I think. And so the actual stores that were selected, I'll also take a moment to say something about that. So these are stores that almost all of them were funded by a program like the Healthy Food Financing Initiative or the Pennsylvania Fresh Food Financing Initiative. They're in places that otherwise would have been absent a supermarket. They're low-income census tracts, low to moderate income, otherwise called food deserts, and they're the same pictures that you keep seeing over and over of stores that have been funded. The partnership was with Fresh Grocer and ShopRite, also Uplift Solutions, which is a nonprofit of ShopRite, and Temple and the University of Pennsylvania and the Food Trust, as I mentioned. So what kind of marketing strategies did we look at? And I'll tell you, there's a relatively complex table in the paper that goes through each of the strategies and gives you an example of how we used it in different parts of the store. So for the sake of describing what these strategies actually mean, multiple facings. So if we go back to my good friend Bart Simpson here. Multiple facings is this place here where the two apples are on shelf edge next to each other. So that would be two facings of apples. There's three apples there. One is behind the other, so you may not see it as a facing, just to help you understand the details of these terms. So multiple facings. We looked at that in particular, how many do you see that are diet versus regular? In the soda aisle, this can be kind of shocking how few diet or even water, we also looked at water, beverages are available at checkout or on aisle compared to the full sugar options. Prime placement, putting something at eye level. Honeycomb, it was funny, when you turn the corner in a grocery store and start to go down the aisle, for some reason, honeycomb is always right here. It's the worst possible placement ever. So we pulled it up, we put it front and center next to the Cheerios, which is typically front and center. We looked at signage. So one of the principles that I neglected to mention up until now is that we did not want this to be a costly endeavor for a store. We wanted to find strategies that very much aligned with the kinds of strategies they were already doing. So in that vein, we did not have a messaging element because we know messaging has to be updated. Things, words get old. They want a, new image, things like that. So we didn't do a whole lot of testing around some slogan or new messaging. What we did, though, when I say signage, is that we spent time talking to the retailers about the kinds of signs that work. And they just said a simple call-out sign, so on shelf edge like this. The price is usually, in a strip, but instead of the price on a strip, you put this price on a tag like that. And what it does is it makes you think that the item might be on sale, or somehow it redirects your attention over to that item. But really, we're not changing the price of the item. We're not doing anything other than just sticking the price on a little tag like that. Sometimes the tags were neon in color, depending on what the retailer had. We just said use the same one you always use. We did some taste testing around milk, and we had kind of an interesting strategy, which there's a paper that's sort of in revision right now around the milk strategy. But more or less, we kind of tricked people into thinking that there were 4 different kinds of milk as part of the taste test, and everybody assumed that, of course, we would have whole milk as one of the options, but we didn't. And so they attributed the whole milk, they attributed lower fat milk to tasting like whole milk, and then they were sort of more open-minded about trying something lower fat. Of course, though, we couldn't stand in the store and do this all day long, so it was a very small proportion of people that we tested, we did the taste testing with. Secondary placements, so you're putting a product then on an end cap, say. So if you have a freezer aisle, we went down the freezer aisle, and I'll go through all the categories with you here briefly, but on a freezer aisle, you have the main part of the aisle, but you may also have an end cap that you can display other freezer items on at the end. So we would do 2 placements of the targeted product, one front and center where it normally would be, and then one at the end of the aisle. And then the last is this idea of cross-promotion where, milk and cereal kind of go together. So if we're going to do a secondary placement of cereal, we would potentially put it next to the milk. So what I'm going to walk through for you next are a couple of slides. So as I mentioned already, we ended up on these 5 categories and specific products in each category. So I'm going to go through each of the 5 categories that we tested and share with you the summary of results for each category and the specific products that we chose. So what we did for milk is we reorganized the milk section so that as you first were encountering the milk, you encountered a lower fat milk instead of a full fat milk. We also reproportioned it so you don't see a sea of red when you walked into the back of the milk section, which is typically what you see because it's all whole milk, but actually allowed for variation in color. And we, kind of made a deal with the retailers to figure out what the right proportion was to revamp it because, of course, they said this would never work. And in the end, we decided that we would agree to have some facings, even if it wasn't stock deep, because they didn't want to throw out wasted milk. But once that intervention was implemented, I'll tell you, this is the stickiest intervention that a researcher could ask for, because they won't go back. They want to keep doing this. They haven't reorganized their milk. They like their milk the way it is, and 9 months, a year later, after we are long gone and haven't even talked to them, their milk still looks like the milk category should look. So this is the intervention versus control, and we did move more 1% in skim milk compared to the control community. In cereal, we had no effect. So my honeycomb that was stuck down there by the aisle, I couldn't sell any more honeycomb. And I know cereal, there's a ton more, things that people will say about cereal price. People like their cereal. It goes on sale often. There's a lot of reasons. We don't know exactly why, but we didn't sell more cereal. Banquet was our frozen meal because it's a top-selling frozen meal. And so we looked at targeting 3 products: the steak meal, the chicken nugget, and the turkey dinner. Now you might say that's a terrible item to target, Allison. Aren't you doing health promotion? But as it turns out, there's actually significant calorie savings for these 3 meals as compared to the other top-selling banquet meals. So we decided we would go where the people were, and let's target the items that they can get more out of. So we were successful with the chicken nugget and turkey dinner, not the steak, although I'll tell you the steak is the top-selling frozen food item in all of our stores. So I think we probably didn't have much movement to go. This is in-aisle beverage sales. So we only targeted in this, if there was a limitation, it would be this, because we were so overwhelmed with the soda aisle. But Pepsi, Diet Pepsi, and Aquafina, we redid the planograms for these sections. We worked with the retailer and the stocker delivery folks to implement it. And we did see some movement on Aquafina. And then this last is the checkout beverage sales, where we were able to have a really meaningful impact on water sales at checkout. Those are those little coolers as you're walking out the door. So everything tended to go in the right direction. I told you I would share with you a little bit about the Arizona study. I'll just say that we're in the process of writing this up, but there seemed to be some promise in not just getting people to try the lower fat milk with the coupon, but also repeating the purchase. So 58% of people who did go back and buy the milk again, the lower fat milk, actually did it more than once, which showed promise. The HIP pilot, I feel like, we have to acknowledge that this enormous study, which really, I think, tested a lot of things, a report has come out. This is a report that we just released in July, and it looks at how many different kinds of approaches there are. There's obviously a number of them, but the ones that have been reported on or talked about quite a bit goes through a lot of the literature that we know about these different approaches, and then talks about the feasibility of a design to actually implement one of these approaches. So look for that if you're interested. Thank you.
Thank you. My name is Melissa Laska. I'm here to talk a bit about our work specifically in corner stores in Minneapolis, in the Twin Cities region, and then also a bit how that links into a broader national body of work that we're doing around corner stores through the Healthy Eating Research Program with Robert Wood Johnson Foundation. So clearly, small corner stores are an important part of the food landscape. They represent, these small convenience stores represent about 30% of SNAP retailers, SNAP authorized retailers. And there's been a real interest, I would say, that's particularly picked up in the last 5 or 10 years in health-related programming that addresses these stores, particularly programming that addresses healthy food access. How do we get healthy foods into these stores? And the one program that I'd like to just spend a few minutes talking about now as a case study example is the Minneapolis Healthy Corner Store program. This has many similar components to lots of other corner store programs that are going on across the country. This is a program that's owned and operated by the Minneapolis Health Department. As a university researcher, I partner with the Health Department on some of their evaluation arms, give limited programmatic input. This is really a Health Department initiative. It's funded by our Minnesota Statewide Health Improvement Program. And it's been implemented in 3 phases. The first phase was really focused on a very small number of corner stores, working directly with a health department staffer on stocking produce and making it visible and attractive in the stores. In phase 2, there was an interest in seeing if we could scale this up just a little bit, and so the health department contracted with a series of community neighborhood organizations who then acted as liaisons between the health department and the stores and provided the programming and the go-between. And now in its third phase that's being implemented now, there's kind of a two-tier approach that's being taken, both that intensive effort to work directly with a small number of store owners, and then also a larger, much more diffuse dissemination effort. Phase 1 and Phase 2 exclusively focused on fresh produce, fresh fruits and vegetables, and now in Phase 3 the health department is rolling in other foods, healthy beverages, healthy snacks, low sugar, low sodium products, etc. There are 3 stages to the program, and I'll just walk through them really quickly. The first stage is a very intensive and a very intentional recruitment and rapport building phase between the city and the store owners that culminates in an assessment that the city does to develop an enhancement plan for the store that's individualized to the store's strengths and weaknesses, and is implemented then in a partnership between the store owner and either the city representative or the community organization that they're working with. These store enhancements take on a number of different forms. There's a number of different components that are employed. Many are similar to the strategies that you've heard in other talks today. There's merchandising and displays to make healthy food visible and attractive. So, reorganizing displays that they already have to just kind of make them look clean and tidy, giving them baskets to put things in, moving things to eye level, products that we especially want to move, moving healthier products to the right-hand side of the cooler instead of the left-hand side. There's also a real emphasis on getting healthy products within sight when a customer walks through the front door of the store. And so here's one of the store owners in the program standing next to his produce display. This is immediately adjacent to the entrance to his store, and you can kind of see in the periphery what some of these corner stores really look like and what the environment looks like. We're dealing with a relatively small display here, but still with a number of fruits and vegetables in there. There's in-store advertising and promotion, so signage and window clings and shelf tags all provided by the city, and the city helps kind of hang them and display them in the store. Cross-merchandising, bringing in other healthy products to market them all together. And then finally, creating more opportunities for healthier impulse purchasing, so bringing some of those healthy foods up to the cash register so they can potentially act as cues as the customers are ringing out. And then finally, the third aspect of the program is a community engagement piece, having community representatives and community organizations come in to do taste testing, to do cooking demonstrations, promotional events, just really trying again to draw the neighborhood into the store. There's been a number of evaluation components that the health department has led in the different phases of the program. The one that I've really been most closely involved with is a sub-study evaluation that we did in phase 2 of the program, collecting objective POS data. We did this in 7 of the corner stores that the health department worked in. So it's not a large number of stores, but this was an incredibly intensive effort that required a lot of time and a lot of resources. And I can talk more about that if people are interested. But just in a nutshell, all 7 stores had POS systems in place prior to being recruited into the program, but they weren't really using them. They were just using them as basic cash registers. They weren't using a highly itemized checkout system. So the city contracted with some retail consultants who came in, reprogrammed the POS systems, and then trained store owners, and if they had any employees, trained their employees on ringing out customers, specifically pulling out the produce sales. So then we were able to look at those results over time. Here you're looking at some of the data that were generated from those sales data. On the y-axis here, you're looking at percent of fruit and vegetable sales as a function of total store sales. And in the red line, you can see there are the sales data from 5 intervention stores. 5 of our 7 stores were considered intervention stores because they received their enhancement after week 4, which is that first vertical dotted line. And then the blue line represents sales in 2 control stores that received a delayed intervention after week 14, which is that second vertical dotted line. So you can see when we compare weeks 1 to 4 to weeks 11 to 14 in sales in those intervention stores, it looks like we're trending upwards. In the blue line, it looks like there's just much more noise in the fruit and vegetable sales data. And what we did, we saw that there was an increase in fruit and vegetable sales in the intervention compared to the control stores. We also saw statistically significant increases in fruit and vegetable transactions as a function of total transactions in these stores, and saw an increase in WIC fruit and vegetable redemptions as well. We got WIC data from the state on these stores during this time period and saw changes there. We were in the stores at follow-up doing customer intercept surveys as well. We did over 200 customer intercept surveys and saw that there were things like more favorable perceptions of neighborhood fruit and vegetable availability among customers in those intervention compared to the control stores. We saw more self-reported fruit and vegetable purchasing in the intervention stores. So in general, you know, I think we're seeing generally a sign that things are moving in the right direction, suggestive of a positive change. A couple of caveats that I think are worth noting here, though. First of all, this program, much like many other programs, Healthy Corner Store programs, implemented all of its in-store strategies at one time. You know, going into the store and just doing one enhancement all at once, and then trying to maintain that enhancement over time. And so we weren't able to kind of break out specific strategies and the relative impact of one in-store strategy versus another. We're just really looking at aggregate effects. The other thing is really that's worth bearing in mind here is that the relative magnitude of effect seems to be promising, but when you look at the absolute magnitude of effect here, you're really seeing that we have a long way to go in terms of improving fruit and vegetable sales in these stores. You know, at follow-up, we're still looking at less than 0.5% of store sales being attributed to fruits and vegetables. So it's a little bit of a drop in the bucket, but it's encouraging that we're moving in the right direction here. Now I just want to take a few slides to show you a snapshot of SNAP stores. These are data that we just recently finished collecting in Minneapolis and St. Paul. It's a random sample of licensed stores in the Twin Cities, excluding kind of large grocery stores, superstores, excluding all WIC participating stores as well. This is part of a larger study that we're doing, but in those data that we collected, there were 92 stores that were SNAP authorized. And I think they're nice to take a look at here because we have some data on those in-store strategies that are being emphasized by the Healthy Corner Store program. And so we can look and see, you know, at least in the Twin Cities, how are stores doing at implementing some of these strategies on their own without participating in the program. And you can see here we have kind of a broad array of stores that included in these 92 corner stores, gas stations, dollar stores, pharmacies. There were 37% of stores that had produce that was visible from the front entrance of the store. That doesn't speak at all to kind of the quality or variety or attractiveness of the display, but they at least had one item of fresh produce that was available when you walked in the door that you could see. 63% of the stores did not, and so there's potentially an avenue for improvement there. In terms of in-store ads and promotions, 48% of stores had some kind of in-store ad for unhealthy foods. That could be in hanging signage, in signage that stands on shelves or on the floor, in window clings, etc. Another 30% had neither healthy nor unhealthy foods or beverages advertised in that way in the stores. And so this is another potential avenue for some movement. And finally, when we looked at those impulse buys or things that were within arm's reach of the cash register, we saw that 80% had both healthy and unhealthy foods available close to the cash register. Now, when we were characterizing healthy foods, it's not to say that that was always something like fruit, for example. In some cases, we were broad with how we captured healthy food. In some cases that was nuts or seeds or trail mix that was low in sugar. But broadly speaking, I think what these data say to me is that there's just a lot of stuff in general around the cash register. And my anecdotal evidence tells me that as well in corner stores. This picture kind of speaks to that. And so I think at some point we need to think about not just kind of bringing in and incentivizing healthy food in corner stores, but also somehow thinking about that balance between healthy and unhealthy. Because we can incentivize and we can nudge around healthy food, but if there's so much stimulus related to unhealthy food, the effect may be entirely diluted. So I think, and I don't know how to get at those issues, but in some way we need to think about that balance factor. And finally, the elephant in the room here is the limited healthy food availability in these stores. These are data on the availability of healthy foods, just sample healthy foods in those 92 SNAP stores, but these data map on really well with other data that we've collected in other samples of small stores in the Twin Cities and across the country. We saw that 80% of stores had fat-free or low-fat milk available. 60% of stores had at least one item of fresh fruit available. I have reason to believe that number is a bit higher than it may be elsewhere in other sites in the country, and I can talk more about that later if people are interested. But then when we look at least having one item of fresh vegetable or whole grain products, we're looking at 30% or less of the stores. So there's really this critical aspect of not just nudging, but making sure that the healthy food is available in the stores to be nudged. And I think we need to think carefully about things like the minimum stocking requirements for the SNAP program, for example, to make sure that these products are available for purchase among people that are using SNAP vouchers. Not SNAP dollars. And finally, just a note about some of the challenges. This is just one example of the challenges that corner store owners face. It's not going to be enough, I think, to just up the minimum stocking requirements and say all stores have to carry, X, Y, and Z healthy foods. There's also a significant, or at least a notable amount of technical assistance, I think, that's needed to help stores in the beginning make a transition to carrying healthier foods. Again, these are data from our 92 SNAP stores among stores that were carrying the healthy foods that we're targeting here. These were gathered through interview data with the owners or managers, and they map on really well to a national study that we conducted recently with WIC participating stores, and these data essentially look at how store owners are sourcing their food. And so the take-home message is when you look at those top few lines around low-fat milk, whole grain products, canned vegetable, canned fruit, most stores, about 80% or more, are having some kind of distributor or direct delivery for those sources. But when you get down to fresh fruits and fresh vegetables in those last two bars there, what you see in red is that about 50% of store owners who are stocking those products are going to the grocery store, are going to supercenters, are buying that food themselves, bringing it in their store to sell. And that's just really difficult to make into a sustainable, efficient model. So I think there needs to be some work done on the distribution and procurement end, and once we have kind of enough of a movement going where enough corner stores and convenience stores are needing that kind of procurement, I think we may have some momentum to address that in a more macro kind of way. So finally, that's just one aspect of the challenges faced in working in these settings and the challenges faced by corner store owners. There's a number of challenges that are out there, and I think these challenges are really underappreciated, especially in the academic community that's seeking to do work in these settings. And a group of us, Allison and Joel Gittleson and some others across the country, felt so strongly about this that we recently wrote this lessons learned paper that was published in the American Journal of Health Behavior, really kind of taking a step-by-step approach and looking at all those logistical challenges that people need to know when working with small stores. So I really, this is something in particular that I'm really proud of and I think makes a real contribution to the literature. I would encourage folks to look at this work if you're interested in doing work in this setting. We're also continuing to explore a lot of the challenges in kind of doing this healthy store programming. We're just now finishing data collection on a national effort to look at slotting fees related to slotting fees in corner stores and kind of contractual agreements that corner store owners have with industry representatives and how that may hinder some of our efforts around healthy corner store programming. And so hopefully that'll be coming into the literature soon, but really important to recognize these challenges. So in summary, store-based strategies are varied. There's a number of different kinds of strategies that can be used in ways that we think helps move sales of healthy foods in the right direction. It's really important to recognize those kinds of logistical challenges to working in small stores. And finally, I can't help but believe that improving healthy availability is at the root of a lot of these challenges and is going to be the first kind of step in making movement in this area. And so thinking, how can we get healthy food available in stores for SNAP participants to be purchasing is critical to all of this. Thank you.
Terrific. Thank you, Melissa. That actually is a fantastic paper about how lessons learned from working with small stores that I would encourage people to look at. It's fantastic, and I share it broadly. So I'm here this afternoon to talk with you about the SNAP Education Retail Program in California. And what I'm going to do is share some of the point-of-purchase nudging strategies that the retail program has used in California, and then spend a little time talking about some new emerging areas, and that's particularly in this area of working on access issues with smaller retailers, neighborhood stores in low-income communities. And then I'm going to close by sharing an advancement, sort of an exciting advancement, and that's the SNAP Ed evaluation framework, which is relatively new, and it was developed with the leadership of USDA's Western Regional Office. But it's a real advancement because it's going to help us evaluate the retail program, but also evaluate the great diversity of nutrition education work and environmental support work, increasingly, that's happening under SNAP Ed. It's going to help us tell a more coherent story. So just one slide on history. So retail partners have played a role in shaping SNAP Ed in California for over 15 years, almost 20 years. So several major supermarket chains were members of an advisory committee that developed the first California 5-a-Day program. And so when targeted campaigns were developed to reach children, or the Latino campaign, they included a component of doing education and promotion at stores. So not just in schools or in the church setting, but also in stores. So I just wanted to sort of show that that was sort of our look and feel with California 5-a-Day, and now we're champions for change. So the purpose of the retail program is really to facilitate these kinds of retailer and health agency partnerships with the goal of increasing purchase of fruits and vegetables, not just fresh, but frozen and canned as well, among SNAP shoppers. In California, the SNAP program is called CalFresh, so CalFresh eligible Californians. And this is done by providing merchandising materials, strategies, and tools that are aiming to inspire healthy change. Oh, I'm sorry, I'm going to show you, this is Edith Gomez. She's a retail specialist. She's food safety certified, bilingual. She works with a nonprofit, the Health Education Council, and here she's doing an in-store food demo where shoppers have a chance to have a taste test. She has a chance to interact with people, and people take shopper takeaways. She's also someone who plays a critical role in stocking merchandising materials. I think that was mentioned a little earlier, but that can be a challenge too. So last year, in California, the SNAP education program had merchandising materials and those kinds of in-store promotions in over 800 SNAP Ed eligible stores in a tremendous variety of food banners, but also a real variety of store formats. So large chains, also small chains, independent grocers, and even small neighborhood stores. So when I say SNAP Ed eligible stores, that means stores that are located in neighborhoods where the majority of residents are low income, or they're identified as stores that have relatively high SNAP redemption. So some of the nudging strategies that the retail program has been using been talking about all today, but are things like visual cues in and outside of the produce areas, but materials developed for various store formats. A lot of these materials link to other targeted campaigns that are happening in other parts of the community or in schools. So it might be recipes that are also promoted by the Latino campaign or African American campaign. We have another campaign, Harvest of the Month, which promotes seasonal produce. A lot of the store items link to that campaign. A lot of the materials are shopper takeaways, so recipes, quick tips, as well as these kind of personal connections being in the store, but also events, store tours. So let me just show you examples of some of the merchandising materials. Here's a wall poster, a standing poster that's got an area for recipe cards to be held, a spinning kiosk that has recipe cards, and a shelf tag. It's actually a magnet, sticks to metal shelving. All the materials are in Spanish and in English, and all the materials really have a positive imagery of showing that people are enjoying healthy food and enjoying each other. A lot of the materials have nutrition messaging. For very common produce items, there's nutrition signage for the produce area. Like this one for apples talks about the fiber that you can get from apples and the benefit of fiber, as well as storage tips, which we've been talking about earlier today, are really important to SNAP shoppers, that they're able to store and keep items longer. Here's another signage which was developed specifically for inside a supermarket cart, and that's the My Plate message. So it's kind of the idea of you should fill half your cart with produce if you're going to have half your plate be produce. So as I mentioned, there's a variety of shopper takeaways, so that would be easy to make recipes, but they're healthy. Newsletters that link to these seasonal produce items that will have mostly tips about how to incorporate these items into your regular meals. So let's see some of these in real stores. Here we can see the poster, standing poster. It requires space. So this is more for a large store format. The spinning kiosk is on the counter there, also requires space. So these items kind of fit well in a large store format, but we also have materials for a small store format. So here's the Harvest of the Month promoting persimmons. It's a fall item. And even though the space is small there, there's plastic displays to hold the recipe cards and newsletters. It's not uncommon for neighborhood stores to, they don't have a merchandising department, so it's not uncommon for them to make their own hand signs for prices. So this is showing a before, a market where they've made sort of homemade signs on cardboard. And we have these templates, My Plate price tag templates, where you can write in with a grease pencil the price. So in the after, it can give sort of a little more professionalism, a sort of nicer look and feel. We've also worked with WIC to have co-branding and cross-promotion, so to include fruits and vegetables together with your meals that you're making with common WIC items. So you can see them in the store. So here's one where, by the brown rice, there's a magnet shelf tag, which is encouraging folks to have vegetables with their stir fry, which would be with brown rice and chicken. And then in the cereal section, the idea of having apples added to your oatmeal. So there's cues also outside of the produce section, so window clings in the frozen food area. And then this sign is also a window cling, but it was developed for small neighborhood markets that perhaps weren't selling produce before, and now they are. So it can be put on the front door to say fresh produce sold here. So all these materials and others can be purchased through an online store. Our local partners are able to access them and order them online to be delivered to them for free to SNAP-Ed eligible retailers who they've made partnerships with. But we all know from our own shopping that the supermarket environment is very busy. It's very competitive for information. There's a lot of information there. So perhaps some of the best cues are actually in-person promotions. So this is a service that is provided to SNAP-Ed participating retailers where a food safe certified staff member will come in and do about a 4-hour promotion. They are showing recipes and they're giving people a taste test, and people will be often surprised that they like very much the taste test. So it's that personal interaction. The retail programs developed a great variety of training materials, how to do these food demos, how to do store tours, and most recently, some materials that were developed for small stores about the handling and purchase, let's just make a good point about purchase, of produce items, how best to do that. There's a Fruit and Veggie Fest. It's a signature event, but really what's beneficial about this signature event is that it's a chance for very positive media about the efforts of these store partners to be a source of health in their communities. It generates media, both Spanish and English language media. It's like a health fair, but often the retailers will also use the opportunity to have like produce promotions, like offer a very good price for produce that day. And hundreds of people can attend these, and it gets positive coverage. And that's part of what these partnerships can offer to retailers, is that sort of positive image and increased store traffic. Let me take just a few minutes to talk about some emerging areas. So that is more looking at access to healthy food. So we have a number of tools that we are using to assess the community food environment. So not just stores, but also restaurants and food pantries and areas surrounding schools. We call these communities of excellence in nutrition, physical activity, and obesity prevention. The results from these kinds of assessments are used to work with retailers and community groups and residents, most importantly, to have strategies for how neighborhood stores might be improved. Several of our local partners have done pilots about placement. Let me just show a little bit about the CX3 data collection. So the real idea of this is that you would gather real-world neighborhood information about your neighborhood that's going to activate community groups and ideally residents to make healthy changes in those communities. So it starts with GIS mapping. The purple area is SNAP-Ed eligible community area. So the census tract has 50% or more having income below 185. So that's the first starting point, is that's where we can focus. And then there's field surveys going into the stores. One team here is looking at what produce is sold, and they assess the quality, they assess the price, and the variety. Another team is looking at what else is being sold there. They have sort of a menu of what are the healthy items there. Every store gets a score. It can be from 0 to 100, and we think of 75 as being our target. And the scores are based on what products are stocked, the marketing, the healthy marketing, and foods that are less healthy that are marketed. The environment, especially around the checkout area, is assessed, and also outside the store, the external environment. So here's an example of local health department in Los Angeles. They worked with a variety of partners. So some that were CDC funded from CTG grants and were able to work with small stores. But here shows the before picture. The store's across the street from a high school. Gets a lot of high school traffic at the end of the day or before the day. And it didn't sell produce at the beginning. Their CX3 score for the store survey was 23. And then afterwards, through working in this partnership, and actually the store owner was a real champion. The store owner wanted to be more of a healthy place for the high school and the surrounding community. So afterwards, they were able to have produce sold. They have these sort of simple baskets. A little hard to see, but those are the My Plate price tags where they were able to write in the prices. And what you also can't see is that the prices are pretty good. So you can get 3 apples for $1, which is certainly better than the airport, but that is not a bad price. They also were able to get a produce refrigeration not with SNAP money, but through CDC or through other partners. A lot of the really strong programs have a youth involvement component. So here were youth, this is in Northern California, they were involved in having healthy messaging come into the supermarket, and then they also painted murals outside in Spanish and English that are promoting specific produce items. Several partners have done healthy checkout lane pilots in the Bay Area. The retail specialist worked with the owner of the Artiagas. It's a small chain. And they use the same shelving. I mean, that's the same shelving that's normally there, but it's got produce in it now. And it's the same refrigeration case, but it's got a lot more water in it. So here's a quote from Lupe Lopez, who's the owner of Artiagas. And she says, I can actually move a lot of fruit through that aisle. It's not something you're losing money on. It's an opportunity to increase sales. Produce at the checkout stand is so popular that in addition to the dedicated healthy checkout lane, I made room for a basket of produce by every register. There's another pilot that's being just started with 2 local health departments, and that's a healthy retailer recognition pilot. So we are Champions for Change, and we're wanting to work and identify champion retailers for change. So this is being based on the food trust model. It's got several levels. The more changes that a retailer makes, the more recognition they're getting. So I said I wanted to close with this advancement, which is the SNAP-Ed evaluation framework. And it's got a menu of indicators that can be used, but it's to measure both the impacts of direct education, but also changing access, which is needed to help people be able to act on that education. And also indicators that you're working collaboratively with larger efforts. So not just SNAP-Ed alone, but working with larger efforts to reduce chronic disease. Some example indicators which pertain to the retail setting are trying to improve access, create appeal where people live, learn, work, play, and shop, but in farmers markets, grocery stores, food retailers, and food pantries. So some of the type of environmental changes are the indicators that we'll be tracking are things like, were improvements in the layout or display of food made? Are there point of purchase and distribution problems? And actually, are they selling? Is it available? Is fruit and vegetable available? So the retail program has really been based originally on the premise that health-oriented agencies and retailers working together can have mutual benefit. But it's really win-win-win in that it can help health agencies achieve their goals. Ideally, it can help retailers improve their bottom line and their sales of healthy foods. And most importantly, it can help SNAP shoppers, or CalFresh shoppers in California, have good information, prompts, and access to affordable, healthy food, which will ultimately really benefit them and their well-being. Thank you.